In today's world, the desire to look younger is everywhere. We see it in glossy anti-aging ads that promise to turn back the clock, in billboards that showcase flawless skin, and in the pages of beauty magazines filled with tips and tricks for maintaining a youthful appearance. The pressure to look ageless isn't just a passing trend, it's woven into the fabric of our culture, influencing how we see ourselves and others. On social media, the pursuit of perfection is even more intense. Filters and editing apps make smooth, wrinkle-free skin the norm, setting a standard that can feel impossible to reach in real life. Every scroll through your feed is a reminder of the youthful, glowing faces that dominate our screens. At the center of this modern beauty movement is Botox, a treatment that has become almost synonymous with a smooth, youthful face. With just a few tiny injections, Botox promises to erase years from your appearance, smoothing away lines and wrinkles that tell the story of time. For many people, Botox isn't just about vanity or chasing after an impossible ideal. It's about feeling confident in their own skin, about aligning their outer appearance with the vibrant, energetic person they feel like on the inside. It's about reclaiming a sense of control over the aging process, and sometimes, about fitting in with peers who are also embracing these treatments. The procedure itself is quick, often taking less than 15 minutes, and the results can be seen in just a few days. It's no wonder that Botox has become a common topic of conversation among friends, at coffee shops, and even in the workplace. What was once a secret is now openly discussed, shared, and even celebrated. But behind the popularity and the promise of instant youth lies a more complicated reality. Botox is a powerful substance, and its effects on the body and mind are not always fully understood. The risks, ranging from mild side effects to more serious complications, are often glossed over in the excitement to look younger. That's why it's so important to look past the marketing and the hype. We need to understand what Botox really is, how it works beneath the surface, and what it can truly do to our bodies and minds. Only then can we make informed choices about our own beauty journeys. So, what exactly is this mysterious substance that has captivated millions? How does it work to smooth away wrinkles and create that coveted youthful look? The science behind Botox is both fascinating and surprising. The journey of Botox, from a deadly toxin to a beauty staple, is a story filled with innovation, risk, and cultural change. As we explore its history and its impact, it's crucial to ask ourselves, what is the true cost of ageless beauty, and is it worth the price we pay? Botox is a purified form of botulinum toxin type A, a substance that has a fascinating and complex history in both medicine and cosmetics. Originally, this toxin was known for causing a rare but serious illness called botulism, which can result from contaminated food. However, scientists discovered that when carefully purified and administered in extremely small controlled doses, it could have beneficial effects. Botox is produced by the same bacteria, Clostridium botulinum, that causes botulism. In the lab, these bacteria are cultivated under strict conditions, and the toxin is extracted and purified to ensure safety for medical use. The resulting product is incredibly potent, but for cosmetic and medical purposes, it's diluted and used in minuscule amounts. Even a tiny dose is enough to achieve the desired effect, which is why precise measurement is so important. Botox works by blocking the chemical signals that nerves send to muscles, specifically the neurotransmitter acetylcholine. This interruption prevents the muscle from contracting, resulting in temporary muscle paralysis or relaxation. It's this unique mechanism that makes Botox so effective for both cosmetic and therapeutic uses. When injected into facial muscles, Botox smooths out wrinkles and fine lines by relaxing the muscles underneath the skin. This is especially effective for dynamic wrinkles, those caused by repeated facial expressions like frowning or squinting. The effects of Botox are not permanent. Typically, results last between 3 to 6 months, depending on factors like the area treated, the dose used, and individual metabolism. Over time, the nerve endings regenerate, muscle activity returns, and wrinkles may gradually reappear, which is why repeat treatments are often necessary to maintain the results. Beyond its cosmetic applications, Botox has proven valuable in treating a variety of medical conditions. For example, it can help manage muscle spasms, excessive sweating, and even chronic migraines by calming overactive muscles or glands. Because Botox works by disrupting nerve function, precision during injection is absolutely critical. Each injection must be carefully placed to target only the intended muscles. minimizing the risk of unwanted effects. If injected incorrectly, the toxin can affect unintended muscles or even spread beyond the target area, leading to complications such as drooping eyelids, asymmetrical facial expressions, or difficulty swallowing. This is why it's essential to have Botox administered by a trained and experienced professional. The powerful effects of Botox highlight the importance of expertise and careful technique. A skilled practitioner will assess your facial anatomy, discuss your goals, and determine the safest and most effective approach for your treatment. Understanding how Botox works and the science behind it is key to making informed decisions about its benefits and risks, whether you're considering it for cosmetic reasons or for a medical condition. Botox has exploded from a niche treatment reserved for celebrities and the wealthy elite to a household name recognized around the globe. What was once considered a luxury procedure is now a routine part of many people's beauty regimens, with demand growing every year. Today, Botox is the world's most common cosmetic procedure, performed in clinics from New York to Tokyo. Waiting rooms are often packed with people of all ages and backgrounds, eager for a quick fix to wrinkles or to enhance their appearance. In the United States alone, millions of injections are administered each year. For decades, Botox has topped the charts as the go-to non-surgical cosmetic treatment, outpacing other procedures by a wide margin. The rise of social media and the influence of celebrities have played a huge role in making Botox mainstream. Platforms like Instagram and TikTok are filled with influencers sharing their Botox journeys, normalizing the procedure for younger generations. Now, even people in their 20s are seeking preventative treatments, hoping to delay the signs of aging before they even appear. Botox is now available almost everywhere, from specialized cosmetic clinics to dental offices, and even in some general medical practices. Advertisements for Botox can be seen in storefront windows and on billboards, making it more accessible than ever before. The trend has even led to the rise of so-called Botox parties, where groups gather in homes or private venues to receive injections in a social setting. These events are marketed as fun and convenient, but they come with their own set of risks. This easy access, however, brings significant risks. Many injectors aren't doctors or medically trained professionals, and regulations can be inconsistent or poorly enforced. In some places, almost anyone can offer Botox injections with minimal oversight. In the UK, for example, most practitioners offering injectables aren't medically qualified, raising serious safety concerns. Patients may not always be aware of the qualifications of their injector, putting their health at risk. The booming global demand has also fueled a dangerous black market for counterfeit Botox. Fake products, often containing unknown or harmful substances, are seized by customs officials around the world, but many still slip through the cracks. With so many people getting Botox, even rare complications can affect thousands. Side effects can range from mild bruising to more serious issues like muscle weakness or allergic reactions, especially when treatments are performed by unqualified individuals. As Botox's popularity continues to soar, understanding the potential risks and ensuring treatments are performed by qualified professionals is more important than ever. In a world where beauty trends spread faster than ever, being informed is the best way to stay safe. The biggest dangers often come from counterfeit Botox and unqualified injectors. Fake products can be contaminated or improperly dosed, leading to severe reactions. In 2024, the CDC warned of botulism-like illnesses in women who received injections from unlicensed providers in non-medical settings. Symptoms included vision problems, drooping eyelids, and even hospitalizations. Similar incidents have happened worldwide, especially with cosmetic tourism. These cases show that the source of the product and the skill of the injector are critical. Bargain prices can come at the cost of your health. Untrained practitioners may inject incorrectly or be unable to handle emergencies. Botox is a medical procedure, not a casual beauty treatment. Always insist on a licensed professional and a legitimate product. What happens after years of Botox? Science is only beginning to find out. Long-term use can weaken and shrink facial muscles, a process called atrophy. This can lead to a less expressive face and permanent changes in appearance. Sometimes, other muscles compensate, creating new lines or unnatural expressions. A 2022 review found changes in muscle function and appearance lasting years after stopping Botox. While some see fewer wrinkles as a benefit, the loss of facial dynamics is a real trade-off. Starting Botox young may set off changes that last long after treatments end. We're still learning the full impact of this decades-long experiment on our faces. Botox doesn't just change your face, it may affect your brain and emotions. The facial feedback hypothesis suggests our expressions help us process feelings. When Botox paralyzes muscles, it may dampen emotional signals to the brain. A 2023 study showed changes in brain activity after Botox, especially in areas tied to emotion. This could make it harder to recognize or feel emotions, and even reduce empathy. Some research suggests Botox might help with depression by interrupting negative feedback loops. But the psychological effects are complex and not fully understood. Botox alters the way we connect with ourselves and others. Its impact goes beyond skin deep. We're only beginning to grasp these subtle, far-reaching changes. Botox's side effects range from mild to serious. Most people experience minor issues like swelling or bruising that fade quickly. But incorrect injections can cause drooping eyelids or facial weakness lasting weeks or months. Some report headaches, pain, or anxiety that linger. Rarely the toxin can spread, causing muscle weakness, trouble swallowing, or breathing problems, medical emergencies. Serious side effects are more common with higher doses for medical conditions. Even with cosmetic use, risks exist and shouldn't be ignored. Weighing these risks is essential before deciding on Botox. Your safety depends on who gives the injection. Only trust licensed, experienced medical professionals. Never bargain providers or non-medical settings. Research your practitioner's qualifications and ask questions. The clinic should be clean and professional, not a salon or someone's home. Make sure the product is FDA approved and ask to see the packaging. If the price is suspiciously low, walk away. It could be counterfeit. Be honest about your health history and medications. Follow aftercare instructions to prevent complications. Taking these steps is your best protection. Is Botox safe? The answer isn't simple. When done by a qualified professional with real products, Botox is generally safe and effective for most people. But the risks, especially from unqualified injectors or fake products, are real and sometimes severe. Long-term effects on muscles and emotions are still being studied. Botox is a medical procedure, not a casual beauty fix. Educate yourself, prioritize safety, and choose your provider carefully. Both practitioner and patient share responsibility for a safe outcome. As research continues, we'll learn more about Botox's long-term impact. For now, approach it with caution and respect for its power.